screaming and I've been crawling after you.
I'm Dr. David Shreve, and my degree is DC, which stands for Doctor of Chiropractic. I'm also board certified in chiropractic acupuncture in the state of Tennessee. I've been in practice for 35 years, and I've been doing acupuncture for about 12, I think, something like that. And in the state of Tennessee, after you've got your chiropractic degree, you have to take over 300 hours of acupuncture classes, plus you have to take a national board exam. I now have over 500 hours postgraduate work in acupuncture. And there's a variety of different reasons that people go to have acupuncture treatment. Now mine is more for pain management. Now in typical Chinese medicine, they would treat a lot of different type of conditions from pain to just general headaches. But in Chinese medicine, they would use acupuncture to treat everything from heart disease to liver function, infertility for females, female issues. But I'm trained that way, but I don't use that as part of my practice. I use it more for pain management. I would say probably I use acupuncture more for back pain, knee pain, peripheral neuropathy, which would be numbness, tingling, burning, and usually it's for most people in the legs or the feet. Well, the obvious would be, you have to have proper sterile technique. So, they would run the risk of infection if they didn't prepare the skin correctly, or they used incorrect needles. What we use in America, we use very, very fine needles. So we use disposable needles. So we would clean the skin, we would use that. Now from an actual treatment standpoint, when they do studies with acupuncture and then they would do like sham acupuncture, there's really no side effects if you put the needles in the wrong place. You wouldn't get the results, but you wouldn't really do any damage. Now the other side effect that you have to be careful of is elderly people who might be on blood thinners. If you penetrate the skin, you could maybe cause a bleed, which of course then would get infected again. The truth of the matter is that with acupuncture, chiropractic, our malpractice insurance is so low because the risk of injury is so little. So I pay very little for malpractice insurance because people just don't get injured using these types of alternative medicine. Exactly how acupuncture works neurologically. Okay. Now, so here's what happens. This is your spinal cord. Now, what happens? You have different type of nerve fibers. You have fibers that we call SDAs, which are small diameter afferents, and these are pain fibers. So if you have pain in, let's say, like your foot or your back, your ankle, what happens is the nerve goes in your spinal cord, the pain fibers decussate here, they cross the spinal cord, they go up to your brain, and you feel pain. Now you have another set of fibers in the body called large diameter afferent fibers. Now these fibers carry vibration, proprioception, kind of tell you where you are in time and space. They go into the spinal cord, and what they do is they split. One goes up the back of the spinal cord to the brain, and one has a little collateral that goes that way. And what it does is when you stimulate that with the needle, the little collateral gates or blocks that pain impulse. Okay? So that you don't have that pathway going up into the brain.